So it's springtime and there comes these awkward stings and bites. I get a lot of calls and asking, is this normal? What do I do with it? I'm Zeinab. I'm the pharmacist from PillSorted. A normal reaction to a sting and bite, what you see is a localized stinging and feeling itchy and quite red. Within minutes to hours, you'll see it gone. The allergic reaction is not just limited to the local area. You will feel the whole histamine cascade. It can happen with any of the stings and bites that are out there, but they're usually quite rare. In the case of infection, when we have that normal reaction to a sting and bite, which makes it red and itchy, if someone scratches it, which usually happens with the children, is that scratching breaks the skin, and when the skin breaks, there's a chance that the infection goes in. So you'd see the redness and itching become worse. It might have some oozing discharge from it, and it'll have yellowy crusts around it. What are the common bites and stings here in the UK at this time? There's mosquitoes and midges, and these are most common on the long summer nights in the evening time and close to water. It usually is a small red itchy bump. The other usual stings is bees and wasps. Bees usually leave their stinger in the stinging area. Wasps don't leave their stingers behind there, and they might sting a couple of times back to back. It makes a lot of redness and swelling. The last insect bite that I want to talk about is tick bite. So ticks are these tiny little insects. They're usually in the long grass or the woodlands. If you see this tick, you want to remove it with the tweezer or with your fingers, but you need to pinch as very close to your skin as you can because they latch in really hard. They can be carrier of Lyme disease, and how it shows is within a week up to 4 weeks, you'll see a very distinct red patch that has got like a bullseye red in the middle as well. Now, plants. What are the most common plants? Nettles is one of the most common ones. They inject histamine directly into your skin, so they cause that redness and itchiness. There is another one that's quite common, is called the giant hogweed. The thing that you want to avoid is the sap. The sap might look like a clear water, but when it touches your skin, it will make a big burn. For that burn, you really need to be mindful for it not to see the sun. Okay, so how do we treat them? Make sure you wash it, because it will help cool it down. And antihistamines. There are topical creams as well. The anti-Zeinab hydrocortisone cream, Savlon. What do you need to look out for? If you see any signs of an allergic reaction, in that your lips and face become swollen, you find it difficult to breathe, those are the ones that you need to call emergencies. If there's any questions you've got anytime, we're here for that clinical pharmacy-led advice. Thank you.